Hey future and fellow OTs, it's Thalia. Welcome back to my channel. So I don't know what I'm saying. Hey future and fellow OTs, welcome back. If you're new, my name's Thalia and I'm an occupational therapist, and this is my channel Endless Education. This channel is meant to empower occupational therapy students, so our future OTs, as well as our fellow OTs. So in today's video, I was requested by one of you to discuss any negatives or downsides of working in the profession of occupational therapy. So it took me a while to think of a few, which probably is a good thing, and most of these you'll see that they can kind of be turned around to be realistic expectations of most jobs, or in themselves benefits as well as negatives at times. So let's jump into it. Number one, let's be real, most people don't actually know what occupational therapists do. So most people don't know what occupational therapy is, whether that's our friends, family, and sometimes even in the professional world of health. So it can be tricky coming into a new treating team, so your team made up of all the different health professionals, whatever setting you're in, whether it's private practice, in a school with teachers, or if it's in a hospital setting, aged care facility, whatever it might be. It can be different with each team depending on each team member's experience with OT, exposure to OT, whether they've had positive or negative experiences in the past, and their general understanding of what our role is within the team, and what we can bring to the team. So it can be different each time, and we can feel that we need to advocate and educate our team on what our scope of practice is within our setting, as well as I've found that teams can there can be a flavor of the month feel with OTs, like they might have learnt that, oh, we can work on handwriting, and that might just be all the referrals you get for a few months are just for handwriting because they've just learnt that OTs can do that, or they might be on a sensory kick and it's all just sensory referrals or things like that. So it can be important to find an appropriate time to do a bit of in-service, so a bit of education for your team when necessary on what our role is, what we really bring to the team. And then of course, friends, family usually don't really understand, and sometimes you might give the half-hearted, oh, similar to physiotherapy, but different, and just getting into long drawn-out conversations. Sometimes it's hard at parties to describe what you do, but sometimes people are really interested, so it actually is a nice conversation to have. So that can definitely be a bit of a downside sometimes, but really it shouldn't be anything that turns you away from pursuing a career in occupational therapy. Number two, paperwork. Paperwork. My least favorite part of my role. All my different jobs had lots of paperwork we had to do. Not lots, but it does take up a chunk of my time in all my different positions. So whether it's notes after sessions or group therapy sessions as well. If you're working in the NDIS space, which is specific to Australia, the National Disability Insurance Scheme here, we have progress reports that we need to do each year for our families who receive funding via NDIS. If they have other funding sources, there's usually also different reports we would have to do to ask for renewal of funds or more funds, or assistive technology reports. Initial assessment reports is the bulk of my admin paperwork at the moment, and then there's just probably lots of other things here and there, emails, returning phone calls, text messages to families, schools, psychologists, all these sorts of things. It takes up a lot of our time, and it's just not obviously the most meaningful part of our job, but it needs to get done. How else would we be able to look back at our goals and see how far we've come? We need to be able to report what we're working on to show others the importance of this family continuing to access our services, and so on and so on. So we know paperwork for the most part is usually important. However, just wish there wasn't so much sometimes. Let me know down below if you feel the same way about paperwork, or if it's something you look forward to. Sometimes it is a nice break after lots of face-to-face sessions to have just a bit of type, to kind of have that little break from person to person for a little while, but it's definitely not my favorite part of the day. Number 3, OT is a caring profession, and with that can come burnout. And she's back with different glasses. I think it's like a month or so later. A bit has changed, but to continue on with this video, we're talking about the effects of working in a caring, giving profession. So we're not alone in this, definitely, alongside other health professionals, nurses, doctors, psychologists, social workers, speech pathologists, probably audiologists, ophthalmologists. I said ophthalmologists instead of optometrists. Everybody, doctors, everyone. And probably many other careers like teachers, anything that's working with people one-on-one or just giving a lot of your emotional and physical energy to others in the moment they're going to be emotionally and physically draining. So I want to talk a little bit very briefly about the effects of working in OT or any other caring profession. So depending on the specialty you're working in, you may be working with clients, patients, families, day in, day out, one-on-one with a small group, talking about highly emotional, distressing, heavy things. Now, it just might be once a day, once a week, but those things, depending on how your self-care is, how your own mental health and well-being is going, can take a toll, can lead to things like compassion fatigue, which is around the decreased ability to empathize and have compassion for others, which is what we need in our job. We need it. But doing it day in, day out, without a break, without being able to fill up our emotional and physical cups in our own ways, can lead to things like compassion fatigue. There's also something else called vicarious trauma, which might be more relevant in settings where you're hearing about a client or a consumer's or a patient or just someone else's experiences that are traumatic, that are quite emotional, that can lead to a type of countertransference known as vicarious traumatization. And it kind of makes sense thinking about it, hearing about someone else's sometimes quite awful experiences and being that person that's a safe space, holding those emotions, helping them hold these awful experiences sometimes can take a big toll on us. So again, our self-care, our well-being, our mental health, we need to prioritize it because we are one of the professions that preach the importance of self-care, whatever that looks like. We need to make sure we're practicing the things that we preach to our clients, to our colleagues, our friends and family, ourselves. I actually do have a video on self-care for OT students and OT clinicians that I made a while ago. I hope it's still helpful. I do get some nice comments on that one, so go check that out wherever the little link is. I'll put it down below as well. So if that's something you already know in yourself that you could use some help with, whether you're an OT student or already a colleague, maybe check that out, do some of your own research and figure out what's going to fit into your own life to help you reduce the likelihood of experiencing any of these things, as well as just career burnout in general. Whew, that was a lot. What was the next one? Number 4. As an OT, we are continuously learning. So I think the next one was around being continuous learner. So this is going to be true for a lot of different professions, especially the health profession, as research just keeps evolving, which is a good thing, but keeping up with the new research, keeping up with the interventions that have the strongest empirical research, all those sorts of things. Yeah, it doesn't just happen while you sleep. It happens by reading, being proactive and looking for the new research, taking time in your personal time to read, to critically reflect, critically analyze the research, the books you're reading. And also we have a duty to make sure we are continuing our professional development through, I think it's 30 hours for us here in Australia, whatever it might be in your country with your OT association. You probably have some guidelines around the number of hours that you need to have each year that contribute to your continuing professional development as an OT. And that can look like reading journal articles, it can look like going to conferences, it can look like a journal club, talking with a few colleagues around journals, presenting, it could be attending training on different interventions. All of this contributes to your ability to be a competent, confident, comfortable clinician overseas, as well as providing the best service you can for your clients and their families. It's really important we stay on top of the latest research, and so it does take time to go out of our way to make sure we are keeping up with the latest trainings, evidence, all those things that we learn at uni. It doesn't just stop there, it keeps on going, and I'm sure that's exactly the same for the other health professions as well. So if you think you can escape that learning bug from once you finish uni, no, it continues. You have to be a lifelong learner to make sure you're keeping up with the profession and the advancements, and it's always really exciting to learn about the different advancements in our research, so it's not a bad thing. And kind of along that same vein is number 5, university can't teach us everything. I wish we could just walk out of our 4-year degree knowing everything we needed to know for the job, and just that was it for the rest of your life. That's all the knowledge you need to know. You might just apply it slightly differently, but no. It's, for us, was a 4-year degree. For you, it might be 3. For you, it might be 6 plus. I don't know how many years it is for you, but it is impossible for our universities to teach us every single thing we're going to need. I do believe they teach us a great deal, and it is important to have a degree, don't get me wrong. But they teach us the theories, the frameworks, the models, how to critically analyze evidence, what we read, they teach us, they allow us to start practicing putting theory into practice through our placements and field work. But when it comes down to the nitty-gritties of, okay, so I have this kid with this kind of background, this kind of family, I have these resources today, and now we're doing telehealth. We don't specifically go into every single situation that might come up. So that's where our foundational skills we learn at uni kind of kick in and allow us to kind of be problem solvers, be curious, be creative, and work with what we have in front of us and continue to learn, to seek out information when we don't know what to do. So we're not going to get all the answers from university, but they do give us a very good start. So if you're looking for a profession where it's 4 years, that's it, and go straight into the job, no questions you need to ask when you're there, it's probably not the job for you, and probably not most, if not all, health careers as well. Continuously learning. Okay guys, thank you so much for watching this video. I hope it was helpful, and I hope to whoever requested this in the comments, I don't know if you want to be anonymous, but I'm keeping you anonymous. I hope this was somewhat helpful in helping you to kind of reflect on where you might want to go with your career as well. So any questions, comments, leave them down below, and I'll see you guys in the next one. Bye guys. Okay, so these are my new glasses. It was very disappointing going into glasses stores because they don't have very fun options. Why are they more fun on the inside and not the out? Like, who is this for? Who's like, I want this on the outside. I want them to be a party on the outside, not the inside.